Our topic of discussion is mechanism of drug action. This is the continuation of the previous video. Okay, we'll go to the next slide. What is mechanism of drug action? The term mechanism of action refers to the specific biochemical interaction through which a drug substance produces its pharmacological effect. When a drug interacts with enzymes or bind with the receptor, it shows its biochemical effect, which is biochemical interaction. And then it shows its pharmacological effect. A mechanism of action usually includes mention of the specific molecular targets to which the drug binds, such as an enzyme or receptor. Drugs that do not bind to receptor produce their corresponding therapeutic effect by simply interacting with chemical or physical properties in the body. Common examples of drugs that works in this way are antacids and laxatives. Okay, there are some drugs which do not bind with the enzymes or receptor. They show their physical or chemical impact in the body without binding with any enzyme. Okay. First example of such drugs are antacids. Antacids are medicines that relieves heartburn and indigestions by reducing the amount of acid in your stomach. Antacids neutralize the acid in your stomach by stopping an enzyme that creates acid to break down food for digestion. Next is laxatives. Laxatives are substances that loosen stools and increase bowel movements. They are used to treat and prevent constipation. They do not work on any receptor or combine with any of the enzyme. Let's go to the next slide. First is enzymes. Almost all biological reactions are carried out under catalytic influence of enzymes. Hence, enzymes are a very important target of drug action. Usually, most of the drugs shows their action when they come and combine with enzymes. For example, substrate, inhibitor, they both are attaching to the enzyme. These drugs are made of some functional and non-functional products. Drugs that act by inhibiting enzyme include anticholinergics, which enhance the action of acetylcholine. So, anticholinergics enhance the action of acetylcholine. Okay. Difference between competitive and non-competitive inhibition. Here are some differences. First is competitive inhibition is the binding of the inhibitor to the active site of the enzyme. This is very common. Non-competitive inhibition is the binding of the inhibitor to the enzyme at a point other than the active site. Okay. Competitive inhibition occurs when a substrate and inhibitor compete for the same binding site. In this, substrate and inhibitor, they both bind at the same site. Here in non-competitive inhibition, inactivates the enzyme rather than simply preventing binding. Okay. In competitive inhibition, the inhibitor is structurally similar to substrates and hence compete with the substrate to bind at the active site of the enzyme. Whereas in non-competitive inhibition, the inhibitor reduces the activity of the enzyme and binds equally well to the enzyme whether or not it has already bound the substrate. Okay, here are some enzymes with their substrate and inhibitors. Competitive inhibitors. You can read this and use as example for competitive inhibitor. Omeprazole is very common example in non-competitive inhibitor. Thank you. Sorry for delay in the video. I was actually not well.